Hi, I am Dr. Smita Vats and I am a practicing gynecologist in Gurgaon, visiting Artemis Hospital and 30's hospitals. So today we are discussing about various issues related to age-related effects on fertility and what you should be considering about when you're planning for pregnancy after the age of 30 years. So over the past 30 to 40 years, the women in India have had more access to higher education, career opportunities, professional growth, and contraceptive measures. As a result, they are more in control of their life choices in general. So consequently, more and more couples are now deferring their pregnancy plans to a later age when they are more financially secure and sort of more settled in life. So while this is good for planning purposes and this makes them plan childbearing and family planning and everything in a better way, but there are certain age-related effects which most people are not aware of, and they're not aware of what interventions they should be doing and what precautions they should be taking while they're planning a pregnancy after the age of 30 years. So this video is more about increasing awareness over such issues, and we'll be dealing with all these aspects step by step. So coming to the first thing, the effects of age on fertility are, to consider, every girl is born with a certain fixed number of eggs when she's born. So no new eggs are formed during the lifetime, and suppose if a girl is born with about 1 million eggs at her birth, the number of eggs continuously dwindles as the age progresses. So by the time you reach your puberty, almost a person has, say, about 300,000 eggs left. And by the time you reach the age of 37 years, only about 25,000 eggs would be remaining in the ovaries. And not all these eggs would be of good quality and may not lead to a healthy pregnancy when they are fertilized. So by the time you reach your menopause, all the eggs are obviously finished, but the fertility starts to decline about 10 years prior to menopause. So if a woman who's less than 30 years of age has about 25% chances of conceiving in a given cycle, the women who are between 30 to 35 have about 20 to 25% chances in a given cycle. So the fertility is not affected much in those 4-5 years. But beyond the age of 35, the fertility decreases drastically, and a woman has only about 15% chances of conceiving in a given cycle. And beyond 40, of course, the chances are much lesser. They are only about 5 to 10%. Added to that, the rates of abortions and miscarriages are also increasing with age. So anybody who's less than 30 years has, say, about only 10 to 12% chances of losing a pregnancy. But after that, between 35 to 40 years, the chances increase to about 20%, and beyond 40 years, they increase to maybe 30 to 40% whenever pregnancy is there. So having considered all these things, once the pregnancy happens, then also the chances of complications are higher in women of maybe more than 35 years of age. So there are increased chances of miscarriages, increased chances of low birth weight babies, preterm deliveries, cesarean sections, more chances of pregnancy-induced diabetes, high blood pressure, and other complications related to the pregnancy. So consequently, any pregnancy which is beyond 30 to 35 years of age needs more care as compared to a person who is younger and getting pregnant. So of course, not much drastic measures are required between 30 to 35 years of age, and most women in that age group may conceive even without much of medical intervention. So when the question arises, when should you be seeing a doctor when you're planning a pregnancy after the age of 30 years? So when we think of that, so if anybody who's been planning for pregnancy and has been trying consistently after the age of 30 but less than 35 years of age, so if you've been trying for more than a year and still not conceived, then that is the time that you should be meeting a gynecologist and probably get yourself evaluated to understand what the problems are and how to deal with them. Beyond 35 years of age, maybe the duration is shorter, and if you've been trying for 6 months and still not conceived, then that's the time to visit your doctor. After 40 years of age, as soon as you start planning a pregnancy, you should be meeting your doctor. This is to see whether there are any health issues related to that and which you need to be considered before you plan a pregnancy. Apart from this, anybody who has any pre-existing medical problems, say suppose diabetes, high blood pressure, epilepsy, thyroid disorders, or any other medical issues, you should be meeting your doctor as soon as you plan a pregnancy. So what would the doctor do when you go and meet them? So first and foremost, folic acid supplementation probably would be started, because that is required to sort of prevent any neural tube defects or spinal tube defects in the baby. You would be evaluated in general, physically, and with certain tests, ultrasounds and probably other blood tests, to look for any pre-existing disorders. And if you're already on certain medications, those medications may need to be changed, or the doses may need to be altered for certain medicines for high blood pressure or diabetes, or if you're on some anti-epileptic medications or thyroid medications, those doses also may need to be changed, and sometimes the medications also need to be changed to be probably safer alternatives for pregnancy. So all that would be done. Apart from that, certain vaccinations are required before you plan a pregnancy: hepatitis B vaccine, rubella vaccines, measles, mumps and all. And nowadays even flu shot, that is to prevent against influenza and all, is also given prior to planning a pregnancy. So, and given all this, you should be also taking care of your weight and your BMI. Not that anybody who is obese cannot conceive, but of course the chances of complications are more in women who are overweight or grossly underweight. So it is a good idea to control your weight before you plan a pregnancy, and to sort of achieve, if not exactly ideal BMI, but at least a near ideal BMI before you plan a pregnancy. Then it is absolutely essential to quit smoking and alcohol before you plan a pregnancy, because the effects of smoking and alcohol are long lasting and can be quite detrimental on fertility, as well as may increase the chances of pregnancy complications. Apart from this, by and large, the pregnancy for women who are between 30 to 35 years of age is smooth, and they do have a good chance of a normal healthy pregnancy and a healthy delivery. But the chances of cesarean sections are of course higher in women who are of a higher age group, because the flexibility of the muscles is reduced as the age advances, and the tissues become more rigid as the age advances. So, but of course then it varies from person to person, and your doctor is the best judge to decide whether or not to go for a cesarean section. Most of the women can deliver normally if they are well prepared, and if they have sort of been living an active lifestyle, and if there are no other medical complications associated with the pregnancy. And then if we consider various other issues, what all are the factors that the women should be aware of when they are planning for a pregnancy? Mostly once you conceive, the pregnancy will of course need to be more closely monitored between the age of 35 to 40, and you would probably be asked for an ultrasound scan in the initial few weeks only, 6 to 7 weeks, and after that at 11 to 13 weeks there is a blood test which is required, double marker, and another level 1 scan would be done to rule out any gross congenital anomalies or chromosomal malformations in the baby. And another detailed scan would be required at 18 to 20 weeks to look for any other major malformations, and probably you would be monitored more stringently for hemoglobin levels, for blood sugar alterations, for blood pressure alterations, and may be requiring a little more ultrasound monitoring as compared to a younger woman, because the chances of growth restriction and other complications are higher in women of higher age group. Apart from that, many of them may need to be started on certain medications for blood pressure control, for diabetes control and everything. And of course these medical complications can be taken care of by most doctors that you might be visiting. And if the other options that you have when you are younger and you know that you would be deferring your pregnancy for a longer duration, then some women do have the option of getting their oocytes and the eggs frozen whenever they are planning pregnancy later on in life, and these oocytes can be sort of retrieved later on whenever you plan a pregnancy, and when you feel that you're more prepared for a pregnancy as compared to when you're younger. So apart from that, IVF and intrauterine inseminations, assisted reproductive techniques and other options are also of course available whenever you plan a pregnancy later.